All right. Hello, everyone. Thank you for joining us today. I'm Chloe, a marketing associate here at August Schools. So, we're excited to have you here for our session, which is Simplify Student Health, a deep dive into the features our nurses love. So, whether you're joining us from your desk, your clinic, or somewhere in between, we're glad you made the time to be here. So today we're gonna step into a day in your life as the nurse using the August Schools platform. So together we'll walk through charting clinic visits, sending parent messages, documenting medications, managing diabetic students, updating immunizations, and running reports. We hope to have some time for questions at the end. And we are recording today's session. So we'll send out a link afterward and you can revisit it or you can share it with your team if you'd like. So before we dive in, I'm thrilled to introduce Laura, our resident nurse here at August. Laura spent years as a school nurse before joining our team, and she brings that lived experience into the product every day. So in this session, Laura will guide us through a typical school day, showing how August helps nurses handle the unexpected, to stay on top of documentation and still have time for what matters most, which is, of course, caring for students. So thank you for being here, Laura, and over to you.
Happy to be here and show you all kind of a day in the life of a nurse. So I was a nurse at a school before joining August, and I actually was a client as well. So I used the August platform myself in the school setting. And so I thought it would be kind of neat to show you what a typical day could be in your clinic and how you could use the August platform to do a multitude of things at the same time. And while our time today is short, I hope to be able to show you what all you could accomplish in 30 minutes. Now, don't get me wrong, I know it's very hard to get 30 uninterrupted minutes in your clinic, but hopefully this can show you how you can multitask in your clinic with your charting and your day-to-day things that you're required to complete throughout your day. So with that, we're going to kind of set the scene. I'm going to share my screen of the August platform. And so this is going to be, like I said, this is going to be a day in the life. So you can see my day already has started. There's already events that have happened throughout the day. And so I'm going to talk through a little bit about what that looks like here in our August platform. This is what we call the home board. And as you can see, this home board kind of gives me a overview of what has happened in my day. One of my favorite features while I was using the August Schools platform as a nurse was this time clicker right here. This would show me in chronological order how many patients I had seen for the day and what they had come in for. So I would consider this a little bit more of a mild day as I entered this data in, because most of the time this is a much longer list. We've only seen about 12 or so students this morning, but this list can be sometimes feel endless, but you can quickly see that information. I can also see things that maybe I haven't finished charting on that we'll get to today. And then I can see down below, I can see any upcoming medication administrations or ones maybe that I've missed, and then any upcoming scheduled support. So we're going to walk through all of these today to just kind of go through that day in the life and pick up with that after lunch rush of students coming into the clinic. So we're going to start off here with a medication administration. Well, really skipping a medication. So down here below, I can see that Leo was supposed to have his Lactaid here at 11:30 in the morning. And it is now 1 o'clock. Leo has not come in. I checked attendance and Leo is absent for the day. So I'm going to go ahead right here and mark this as skipped and mark that he is absent. Once I do that, that is going to fall off this upcoming medication administrations. But if I needed to go check to see where that went, I do have a general overview of my MAR here that shows all of my administrations for the day. So you can see the other administrations from my day. And if I go to the next page, you would see that skipped medication here as well. So if I come back to my home board, let's say two students come in here at the first together, because everybody comes with a buddy. So I'm going to chart on a student first. Her name is Emily, that came in with a stomach ache. So I'm going to go ahead and search for my student, open up her student card, and you can see here that I have a lot of immediate information about Emily on my student card. Her allergies and her conditions show up here. All of her demographic information shows up, as well as her parent contact information. I can also scroll to see more information here on my student card, but we always encourage our users to open up the student card first, just to get a lay of who your student is, what their maybe allergies or conditions are, before opening up an encounter. Her friend also came in as well, and her name is Zoe. So I'm going to open up actually both of these cards at the same time to just kind of save time. So here within the August platform, you can see I can move these cards. These are our student cards. I could even open up more than just these two if you have multiple students coming in, or if you're just looking at data for multiple students at once. You can pull up these cards and resize them to fit your screen to be able to see multiple students at once. So here within opening their student cards, I'm going to go ahead and start what we call an encounter, and that is a clinic visit of a student coming in. So I'm going to go ahead and choose a clinic visit here. She came in for a stomach ache. So I'm going to go ahead and choose a template here and show you what that looks like. And then I'm going to go ahead and close this out. And then Zoe is also coming in. And Zoe is coming in for a headache and migraine. So I'm going to go ahead and choose a headache visit for Zoe. So now that I have those two encounters open, my most recent encounter is going to be right here. But I'm going to go ahead and show you back on the history. So if maybe I wasn't ready to chart on Zoe quite yet, and I wanted to chart maybe on Emily first, I could come back and X out, and you can see that I have opened both of these encounters for Emily and Zoe at the same time, and they have time-stamped and put in a chief complaint here for me to be able to see that information. So I'm going to come in and chart on Emily first. And again, I used a pre-made template that we have in the August Schools platform. And our templates can actually now be tailored specifically to your clinic and what you are wanting to chart. So this is just one that was made by me to start the visit for abdominal pain. So maybe Emily has some nausea as well. And we are just going to have her rest in the clinic for a little bit. So she presented to this with a stomach ache in the clinic. We'll have her rest before, if she can go back to class. Maybe I took her temperature as well, and she doesn't have a temp, so I can document that here. So instead of closing this note, because Emily has not gone back to class yet, I'm just going to go ahead and close this note here. And then I'm going to come back and chart on Zoe. So Zoe came in for a headache. I'm going to click open her chart, and then I'm going to click back open to look at her profile here. And it says that Zoe has migraines or frequent headaches. So with that, I'm going to check with Zoe to see if she feels like she's having a migraine. And if so, then I'm going to see if she needs to take any medication. So with that, I'm going to come back. And when I come in to add medication here as a treatment, it's going to give me the opportunity to give medication here within my encounter. So if I open up her student card here for administering meds, I can see that she's allowed over-the-counter meds. However, I know that she has migraine medication on file. So I'm going to go ahead and select that migraine medication that she has on file. You can see our order here that she is supposed to have 1 tablet sublingually, and she can repeat in 2 hours if needed. And I'm just going to go ahead and mark my time as right now that I'm going to go ahead and administer this tablet to her to be able to take and rest in the clinic. I'm going to put a little note in here for migraine and add that administration. So you can see that administration has been added directly here into my clinic note, but it will also show up on that MAR that I showed you earlier in the recording here, that it will be present on your daily MAR as well, that was administered. All of our encounters here, even our pre-filled ones, you can add additional information to, or you can take away that information. The summary here I like to use as kind of like your nursing quick note to be able to add additional information that may not be accomplished with our chief complaints and treatments, to give more detail of maybe what you did with your student while they were there within the clinic. So we're going to pretend for the day that Zoe was rested in the clinic for a while, and I finished this note. So she presented with the clinic. I'm not going to finish my note live here, but if I were to be done with this note, she returned to scheduled activities. I may change this to return to scheduled activities in adult notified. I could quickly again open her student card back up again to be able to call the parents to let them know that I administered that Maxalt, so that they know the time that she got that medication today for that migraine. And then once I'm done with that, I'm just going to come up to the top here and close this encounter to be done charting on that encounter. So if I come back to my home board, you can see that I've added those additional visits, so you can see that Emily is still resting in the clinic and Zoe came in. And then I had Ethan is coming in, Chloe just came in to take her medication. So she has a medication due. So if I go ahead and click on this administration, I can see that she has her hydrocortisone, a 20 milligram tablet that's due at 1:15 today, and she has come in. When administering this medication, it's going to give you all of that information. Plus, it's going to give you your remaining inventory. So as I administer this medication, it is telling me that I should have 56 pills remaining after administering this medication. So I'm going to go ahead and click confirm. And that is going to fall off my upcoming medication administrations. So you can quickly administer meds or go through meds that you have administered for the day. Now, one thing that is new to the August platform that I'm going to show you is that we now have the ability to bulk administer or bulk dispense meds. Now, you may not be bulk administering very often, but sometimes when your school has a holiday, say this week we had Veterans Day, if the school was out and you wanted to make sure to action all of those medications, you can now come to the medication section of the environment here and your administrations. So I'm going to come and look at my filter. I'm going to filter it here on the right, and I'm going to go ahead and put a date in here. So Veterans Day was on Tuesday of this week, which was the 11th. So I'm going to type in 11/11/2025, and I'm going to type in at 6 a.m. and select that time. And then I'm also going to type in 11/11/2025 at 8 p.m. That just makes sure that I'm covering my whole entire day worth of administrations. Now you can see it's showing me nothing, but that is because my filter is on today. So I'm going to switch this filter to all so that I can now see all of my administrations from Tuesday the 11th. I have 15 total administrations here that I want to go ahead and skip. So I'm going to come up to this little caret right here, and I'm going to say select all pages. And now I can see that 15 items have been selected, even though this is just 10 on this first page. And then I'm going to bulk update these. So I'm going to choose this bulk update. I'm going to say skipped and say no school for Veterans Day. And then update those administrations. So it's going to take a minute to update them all, but they will eventually all update so that you can see that they have been marked as skipped, and a note is put in that there is no school for Veterans Day. So that's a nice, quick, easy way to be able to do a bulk action on your medications. From there, I have a student who comes in daily for blood sugar checks twice a day. So we have the ability to schedule encounters so that you can chart everything you need to chart for your student coming in. So with that, I'm going to scroll on down. Ethan has come in for his blood sugar check a little bit early, but that's okay. We're going to go ahead and open up this encounter note for him. So this is what we call, again, this is a reoccurring treatment that we have here. And this is a blood glucose monitoring template. So I'm going to make this a little bit bigger to view. But you can see here you have the ability to chart all of the information on the student and about their blood glucose levels. And then again, how much insulin you're giving them, their carb intake, how much time since they last ate. All of that information can be documented here in one place. So my student here has a CGM. I'm going to go ahead and type N for now, and that will give me current time. And then I'm going to type in what his blood sugar is. So his blood sugar is 185. I don't need to do a finger stick to check, so we'll just move on from that. He had his last snack about 3 hours ago, so I'm going to say 3 hours. And then time until next meal, I'm just going to say 15 minutes. He's told me that his carb intake for his lunch today is going to be 15 grams or 60 grams, I'm sorry. And then from there, again, same as we did for that headache visit, I'm going to go ahead and add medication as a treatment here because we're going to need to pre-medicate him with his insulin for lunch. So I'm going to choose choose medication here and come find my order for insulin. So again, it's going to show you anytime you go to administer meds, it's going to show you OTC permissions. But again, we're going to use his personal meds. He's got a Humalog and a Baqsimi on file. I'm going to choose his Humalog. Now that I've chosen his Humalog, on his student card and his medication order, he has a note here that was a nursing note put in about what his orders are about his Humalog. So it says check blood sugar before snack and lunch, give insulin per sliding scale, and carb ratio as ordered. So snack and lunch, he gets 1 unit per 15 grams of carbs, and then the sliding scale here. So we've got at least 4 units here for our 60 grams of carbs that we're giving. And then his blood sugar was 185. So that is here within the sliding scale of 151 to 200. So we are going to give 4.5 units of insulin. When we administer insulin, I'm going to select this base of 1 unit. However, I am going to say exactly how much was administered. So I'm going to say we're administering it now. And I'm going to put in that 4.5 units. You can add a note here of carb count, just so you know when looking back at this. To know exactly how you got to the math of calculating that 4.5 to be able to see that information. But then I can add this administration. And with adding this administration, I've added that here to the note. We have the ability to run reports on this, this encounter template itself. So to get the data out of this information, like how many carbs they were taking, what their glucose numbers were. I can go ahead and repeat my entry here if I wanted to collect that data in a report format. So I can go ahead and put that in and say exactly where it was given. So I'm going to say upper arm here. And then Ethan's done and he's ready to go to lunch. So I'm going to come up and finish that note. So that note is now closed, and you're going to see here on the bottom that I no longer, his upcoming scheduled item is done and not something that I have left to do for the day. Now that I have my kids out of the clinic, I'm going to catch up on a few things real quick. So Carter had come in earlier for a nosebleed here, and I didn't finish my charting, so I need to finish my charting here. He had blood stains on his shirt, and so I gave him a new shirt, and I'm going to send a message home to mom to let her know that he's coming home in a school provided shirt, and that unfortunately he did get blood on his shirt. So blood provided with a school shirt will notify mom. And then I'm gonna, so this was a pre-filled template. So you can see there was lots of options down here for return to scheduled activity, just return if needed, return to scheduled activity, or return to scheduled activity authorized adult notified. I'm going to go ahead and remove these other two since I'm going to notify mom about this nosebleed. So I can go ahead and close this note and finish it out. I'm going to pop open Carter's student card here because I want to send mom a message. So I'm going to come to message threads right here and add a message thread. From here, I'm going to make this just a little bit bigger so that I can see this. This visible to roles allows you to make this note visible to any of the nurses in the building. If you want to keep this a confidential note, you can just say that it's only visible to you. But then I'm going to scroll down, and as I scroll down, I'm going to go ahead and see who I can choose who Carter's guardians are. So Emily and Nathan, you can choose to just notify mom or notify mom and dad. You can notify both. So I'm just going to come on down and let them know that Carter had a nosebleed. And then send this message. So once I've sent this message, you can see that the message has gone through via email. We do also have the ability to send these messages as text messages if that's something that a school chooses. But these messages will be sent, and they would be able to email you directly back from the email that they receive, letting them respond and have a conversation with you if that's something that you're looking for. These messages stay open for 7 days. And if you're needing to start a new thread, you can always start a new thread with a parent. But if the parent tries to email you back outside of that 7-day window, they will get a notification letting them know that they need to contact you through other means because that conversation thread is closed. So I went ahead and sent that message off to his parents, and I can finish that one up. Now, I'm also going to finish up some other charting from the day. So I had a student come in with an injury today in gym class. So we had a physical education injury. She fell on her left wrist while playing volleyball, hurt a pop, and had to be sent home for x-rays. So when incidents like that occur, typically at schools, the nurse is asked to fill out an incident report. So we have the quick note here completed. So I'm going to go ahead and close that. And I had started an incident report here after that incident had happened and she went home. So you can see you have all the available places to chart on this incident. So I can see I've charted the nature of the injury, where it happened, and how the injury happened here. So she was playing volleyball when she went to hit the ball, fell with her right arm fully extended. That should actually be left because it was her left wrist. So we're going to change that here as we're checking it. So her left arm fully extended and landing with all of her weight on that left arm. So it happened during gym. It was a school-sponsored activity during school hours. So we're going to finish this up to complete it. And then it did not occur while traveling. And this is no, it did not occur outside of school. So I'd already date and timed the incident. I'm going to go ahead and put it happened in the gym. And date of first treatment was today. The witness that saw it, I'm going to say yes, they were witnesses. And then I didn't have any other witnesses. So I'm going to go ahead and complete this. And then I can go ahead and sign my name here on my record for this so that it can maybe be an official documentation. If I can get all of my letters in here. So then I'm going to finish my signature. And once this is complete, I'm going to go ahead and close my note here. And then I can go ahead and export this information. So this will turn into a PDF if this is something that you need to print off for your school, for your student's permanent file. You could go ahead and print off that visit so that you can have that. So I downloaded that visit here. And I'm going to come into it and you can see exactly what happened. And then we have the incident report here as well, all able to be printed out and put into the student's permanent file. So that's a nice, quick, easy way to do incident reports. You can also do an incident report by itself so that it does not include the quick note visit so that it's a cleaner look as well. From there, if this day hasn't kind of been crazy enough, we're going to go ahead and close this. And earlier this morning, you can see on my board, I had sent a guardian consult to Blake's parents, letting them know that he was missing a Tdap shot. So I'm going to show you how you can request and get information back quickly from parents within the platform. So this morning I sent what we call a form request to Blake's parents for an immunization record. So if I come into my form requests, I can see that this form request was sent this morning to Blake's parents, and his parents have already sent it back. So it's in this needs review status. So if I click into this, I can see that Blake's parents have uploaded an immunization record. I can click to open it to make sure that that Tdap date that I'm looking for is here on the record. And so I'm going to go ahead and approve this new immunization record for Blake and go ahead and hit approve. And then while I'm here, I see that that date is 10/19 of 20. I'm going to go ahead and open Blake's profile. Again, anytime that you see the student's name, you should be able to open their profile. So to just be able to get this done all at once, I'm going to come over to his immunization page. And I can see that he is non-compliant for that Tdap shot. So I can move this over to the side. If you forgot the date, you can pop this back open again and make this smaller so that you can have a side-by-side view here to make sure you're entering your information correctly. So I'm going to go ahead and enter that date of 10/19/2020 and hit enter. And as I do that, it should change his compliance here to being compliant. Let me make sure his birthday is correct. So I'm going to come out and I will open it back up here and come back and check his compliance here. So it may not have saved. That's what I was afraid of. So I'm going to come in, put in that 10/19/2020. There we go. And unfortunately, it is not saving at the moment. Let me maybe come back out of his profile and come back in again. I might need to hit a refresh right now to see if that will work. We might come back to that one. Let me go ahead and refresh my page. And come on back to his immunizations. It is taking it. Oh, it is saying, well, that was on me. His date is the 10/19. So I can show you that that is the system picking up the rules. So while he had his booster on 10/19 of 2020, you can see in here that it's still marked as non-compliant because it is out of date. So the rule that is being set in this platform is probably looking for a Tdap shot within the past 5 years. So because it is that 2019 of 2020, he is out of date. If I were to change this to maybe 2023 here, I want to show you how that compliance calculates. So if I change that date to 10/19 of 2023, it then would switch that student to automatically being compliant. But that just kind of shows you how the system sometimes knows best than the person entering the data. And while our immunization rules are always changing in the states, we try to keep up with them as best as we can at August to make sure that you have the most up-to-date rules in your system for the state. So you could see there that even though I'm a nurse, I was entering that date, and just because of the rules, it was still marking it as non-compliant. So it's a good little double check there as well. And last but not least, before we wrap up, the last thing I wanted to kind of show you is that on my to-do list, I had that my administrator had asked for a report on clinic visits for the month of October. So here within reporting, we do have individualized queries, but we also have pre-built reports for clinic summaries, immunization data, things like that. To do that, you would just come in and choose a clinic summary. This clinic summary gives you a nice overview of either your whole entire school year, so you can see we have multiple school years in here, or you can come to specific months here of data. So I'd already kicked off a report for this morning, and you can see there's different areas of this report. So while this one's calculating, this is students not encountered in the clinics. We have not seen a total of 173 students, but we have seen, we'll see how quickly this calculates, how many students we've actually seen in the clinic in the month of October. So month of October, we only saw 32 individual students. Now, another thing that I like to come look at is my encounters by chief complaint. This kind of helps give you an idea of if you were having any sickness or if there was certain things going on in the clinic. You can see that in a kind of a quick snapshot here. So if I kind of click on these, you can see I have some bigger numbers here. I can come down and see that, oh, it looks like we had a lot of coughs and congestion compared to other things, runny noses, sore throats. Those were kind of the big things that were happening in the clinic that month. And then I can also come to see like what grade maybe I was seeing the most of. So if I come in, I could give a report that I saw X number of each grade split out here. You can see this nice pie chart here split out, and you can see all of your grade levels. So it looks like 11th grade kind of was the winner of October for the most visits. And then last but not least, the total encounters, there's total notes by type and total by encounters. So the notes here, this one kind of shows you if you used your templates, what you were seeing a lot of. So this is just a basic overview of the types of notes that you saw. This is the broad level picture here. Quick notes are your typical encounters, but then you can break it down even further to those types of notes that you saw within those quick notes. So this is going to give that data here of headache visits, cold symptom visits, concussions, things like that. So it looks like we had a lot of cold symptoms in the month of October, and then just some other general visits for the month. So that's just kind of a quick overview of all the things that you can do in roughly 30 minutes of time here within the August platform. We charted a lot. We looked up some data. So yeah, that is a day in the life of a nurse here using the August Schools platform. I'm going to see if Chloe had any questions in the chat, and we may have some time to answer some of those here live.
All right. Thank you so much, Laura. I think that was a really helpful overview of just some of what's possible in August. And I hope that was cool for everyone to be able to see, you know, this sneak peek into August's platform. So I wanted to see if there are any questions. I don't see any just yet. So feel free to type those into either the public chat or the Q&A section. And we'd be happy to Laura would be happy to go over some answers to those questions. So I just want to give a little time to see if anyone has a question. Okay, so we have a question from Nancy. I'm just going to focus on Laura. So can you put in a date for another immunization that's due? Example, meningococcal. I am not a nurse. So.
Yes, meningococcal that needs. So the way our rules are built into the system is that they are built in on the back end. So we have our rules built out by grade level of when the student, like what grade the student is in, and what the state's requirements are for that grade level. We also look at the state's rules, whether they're looking for intervals between shot dates or if they're just looking to calculate the number of shots. So for that meningococcal, for example, if that was maybe a sophomore student that had their first dose at 11 to 12 and was turning 16 and was going to be due for that additional dose. We do have a status here in August that is expiring soon. So if that student was due within the next 6 months, the system looks ahead for those next vaccines that are due. So for that meningococcal, for example, if that student was due for it, they would turn non-compliant. But if they were maybe not due quite yet and it was something that was coming up for them to be due, we set this expiring soon. That expiring soon gets automatically put as a badge on their profile of their immunizations, and it marks with an exclamation mark for you to know that that vaccine will be expiring within the next 6 months, or it might be shorter by the time that you see it. I hope that answers that question. I can see the chat. How do you make a list of encounters under reporting? Anna, if you could clarify that one, do you mean seeing all of your encounters, a history of seeing all of your encounters? I'll come back to that one. If you could just maybe clarify just a little bit, but I'm happy to answer that one. Currently, we do not have technically a bulk mailing system within the platform. However, you can generate a letter in a PDF form to print out to send with students. For example, maybe a hearing screen referral. You can bulk generate letters for all of the students who may have failed a hearing screen. We do have the ability to send out what we call form requests. So if you have a letter that you just want to put into a PDF type of view for the parents to view, you could do something like that, but we do not have like a bulk mailing system within our platform. And then, yes, parents, this was a question from Susan. Parents be able to upload their medical forms into the August platform. Yes, we call that our enrollment portion of August. And so just like I showed you that form request here, that was a one-off request here for a form. I can click into our enrollment tab here. We didn't really talk about this too much, but you can see if I'm going to filter down to a student that I had started on yesterday. So let's see if I can look at his. So you would see in here, so the parent has just filled out a few things here within this enrollment packet, but as a parent fills out information, it comes across to you. So for example, this was a signature for consent to treat, and then over-the-counter medication consent. There are additional forms here within the packet for the parent to complete. They can upload immunization records, action plans, whatever it is that you need parents to turn in, you can make a request for within the packet. It is customizable for you to be able to build out what your school needs. Provide immunizations. I'm reading Anna's question. If you provide immunization to chart, it is advisable to chart it under their immunization record, or should it be an encounter providing a vaccine? I don't see it as a chief complaint. So if you're just documenting data for a student, and if you want to track that for time spent, a lot of nurses use our encounter here of a consult or indirect support. So I'll open this indirect support here. You can see what kind of indirect support it is. So if I wanted to say that I spent time on this, I could document that Blake here I did some administrative work for, and then I can add that I added a Tdap shot for him. So you can chart that information here under indirect support if you are trying to log your information. Now, if you are the one that's physically giving the vaccine and you need to log that information, you can create a template to be able to collect lot number and all of that information and site, location, how they tolerated it, and actually add it as a medication, because we do have vaccines listed as medications, to an encounter to be able to document that administration. I hope that helps answer that. All right. Trying to get down. This was a question about messages. What happens after they close after 7 days? Is there documentation that the parent was notified? So the documentation is always visible within the platform. So the message that is. So just because the conversation has closed does not mean it's not accessible. So you can go back and read previous messages, previous message threads within the messages. And like I said, if you share it with other nurses, you can see other nurses that have messaged the parents. There is no alert technically within the August system that's tells you that they have been notified that it's been closed. But it does, if you try and go back into it as the nurse after 7 days, it also lets you know that that is a closed conversation, that you would just need to begin another one. Yes, medication expirations. There is a way for you to be alerted of a medication administration. I'm going to come into Ethan real quick. So here on your medication, if I come into his Baqsimi here, I could put in an expiration date when putting in, building out my medication originally. And then we have just released a new feature here in our settings. I'm not sure if I actually have the settings in here. Alerts, here we go. I didn't know if I had the permissions, but I can choose for an alert to be sent to the user, to the nurse, to let me know that that medication is expiring. And I can also set up alert to notify the parent. So we're working on expanding our time frame on these medication alerts. Excuse me, right now it's set up to a week, but sometimes schools want to be notified a month in advance, maybe longer, so that a parent can get that new prescription and drop it off to you.
All right, I'm just going to jump in. Thank you, Laura, for answering all these questions. I just want to say if anyone has further questions, I'm going to include a link here where you can actually directly book time with our team so we can answer other questions you may have. And then also I'll include a link to our website if you would like to explore on your own. So again, thank you so much, Laura, for your time today. And thank you to everyone that made time during your very busy day to join us.
Hope you all enjoy it. Have a great day.